Yes, madam.
Ready? Okay. So if you have read and understood, considering its surgical pathology station, please tell me what is the provisional diagnosis you'll think about for this patient?
My provisional diagnosis is pleomorphic adenoma.
Okay. Right. Please tell me, how would you confirm your diagnosis?
To confirm the diagnosis, I would like there are some specific investigations like FNAC
Yes.
or true cut biopsy to confirm the diagnosis. That will give me the histological pictures of this condition, and
Yes.
that will help to make the diagnosis. And other investigations, I would like to do the radiological investigations, that is MRI for this patient,
Okay.
MRI of the head.
Okay. Why would you go for MRI and not CT scan?
Uh, for the soft tissue diagnosis, I think the MRI has more specificity and sensitivity as compared to the CT scan.
Okay. Right.
But, but if I want to see bone invasion, maybe CT scan will help us. But I think MRI has more specificity and sensitivity as compared to the CT scan.
Right. Please tell me, you've already noticed that the patient has a swelling 4 into 5 centimeter, and it's painless and mobile.
Yes, ma'am.
All right. After you've done your investigations and you've come to that, okay, patient is having a parotid tumor, what management would you suggest for the patient?
After complete history and examination, I would like to do some blood investigations,
You've
like
already done, yes. Yes.
complete blood count to see is there any infectious element is over there to rule out that, and urea electrolytes. And after that, I would like to do FNAC or true cut
Yes,
biopsy
you've
for
done,
like
yes.
tissue diagnosis,
Yes.
and CT scan or MRI. MRI is for the tissue diagnosis, and the management plan is surgical excision.
Yes.
There are a few options like extra capsular excision of the parotid gland or superficial parodectomy.
Okay. All right, we'll discuss
I think
management
these are
little later. Please tell me, you said, okay, this would be pleomorphic adenoma. Would you be able to define the term pleomorphic for me, please?
and pleomorphic means a mass or a tumor which has remarkable histological diversity,
Yes.
like he has ductal or epithelial component as well as myoepithelial or mesenchymal component together as in a same tissue,
Yes.
and the cells are of different size and shapes as well.
Very good. And different staining as well. Okay. Please tell me, how would you define the term dysplasia?
Uh, Dysplasia, ma'am, uh, I will come to this question later on.
Okay. Right. Right. Please tell me, what are the different types of parotid tumors that you are aware of? Broadly classify them and please tell me.
Benign and malignant tumor.
Yes.
In benign, there are pleomorphic adenoma,
Yes, please.
Watson tumor, oncocytoma, and basal cell adenoma and intraductal papilloma. While in case of malignant, we have mucoepidermoid carcinoma.
Yes.
Along with that, there is adenocarcinoma, adenocystic carcinoma, and mixed malignant mixed tumors and squamous cell carcinoma.
Okay. For the investigation in your outdoors, right? You said, right, one you should do is ultrasound, and the second is biopsy. Which biopsy would you use? Fine needle aspiration or a true cut biopsy, and why?
I think in parotid tumors we use fine needle aspiration cytology
Yes.
FNAC
Yes. Yes. Why?
because there is a risk of fistula formation, like salivary gland fistula, so we avoid true cut biopsy in case
Very
of
good. Okay.
parotid tumors.
Right. Okay. And this helps in differentiation between malignant and benign cells as well. Fine needle aspiration. Okay, there is another
Yes.
two terminologies which are often tested in this STEM. This is, how would you differentiate between cytology and histology?
Madam, cytology is basically the study of the cells, structure, and their function. And while in the histology, we study the tissue under the microscope.
Okay,
And, and the cytology will not provide about the information about the architecture of the tissue and will not differentiate about the invasiveness or in situ carcinoma. While in case of histology, it provides a complete architecture of the tissue and as well as the information about the cells as well as their hormonal status as well.
very good. Okay, please tell me. There are two again terminologies which are often tested for this particular station. This is high sensitivity test and high specificity test. But what do you understand by these two terms? Please explain with examples.
Well, sensitivity is the ability of the test that correctly classify the individual as truly diseased, while specificity is the ability of the test that correctly classify the individual as disease-free.
Okay, while okay, you're assisting your consultant and you're operating on this particular patient. Okay,
Yes,
how
ma'am.
would you rule out while you're operating or while you're observing and your consultant is operating that this malignancy or this tumor is not malignant, or is this tumor is malignant?
Uh, it's malignant, madam. If it is malignant, that it involves the facial nerves. If it is
Okay.
malignant, that it is rapidly increasing in size, and
Yes,
it is
while
invading.
operating, you'll realize
Okay,
that,
okay,
okay, this facial
and
nerve
it
is
will
also involved in, yes. All
yes,
right,
it,
you'll
and it
realize.
involve the deeper structures, involve the skin necrosis, and
Okay,
lymph node involvement as well.
right. Even when you're doing fine needle aspiration, how would you realize that this is malignant tumor, or once you are taking aspiration, fine needle aspiration? Is there a way
Yes,
you could
madam.
tell?
Yeah, there are few, we can say, microscopic parameters that will help
Yes,
us to tell that this is a malignant tumor. So
yes,
these parameters are increased nucleus to cytoplasmic ratio,
yes,
hyperchromasia,
yes, very
hyperchromasia,
good.
and increased mitosis, pleomorphism,
Yes,
giant formation of the giant cells, and increased mitotic rate, and increased invasion and distortion of the architecture as well.
very good. Okay, now we'll move on, and please help me and read this, please, if you could.
This one portion is actually a chronoid matrix.
Yes, what are these white?
These are the secretions or chronoid matrix around the normal parotid glands. Secretions we can,
And what are these?
these are
Would you be able
ductules,
to? Okay, very good.
These are
Yes,
ductules
yes,
of the,
yes.
and around the ductules, these are the myoepithelial
Right. Can you
cells.
comment on the
And
stain? Which stain is this?
stain is, and it is eosine and amoxicillin
Yes, yes,
stain.
very good. Okay, please comment on this. Would you be able to
Yes, ma'am.
identify
But,
this?
this is the MRI section of the head and showing that there is a hypoechoic lesion on the left side of the parotid gland region on the
Yeah,
both picture.
yes,
Uh, but it is difficult to differentiate that it is invading or not invading, but
yes.
it could be due to
It
benign or malignant condition, or it could be due to some
could
kind of
be
collection.
benign, yes. But it's dense. Okay, and it's well encircled. Okay, good. Thank you. And if you want to know the answers, so these are the
Yes,
ducts, and
yes,
these
ma'am.
were the adipose tissues. And
Hmm.
these are the serous acini. See, these are
Hmm.
the serous acini. And there is another image as well. You could see these are the adipocytes, the fat cells. These
Hmm.
are the ducts, like you said. And these are the serous acini, and these are the mucous acini. These ones are the. So this is good that you could read and identify and learn. Oh, good. Thank you.
Thank you, ma'am.